Hi, it's Dr. Aaron Gum, founder of Blueprint to Practice Automation, yourautomatedpractice.com. Today I'm going to talk to you about a topic of functional medicine. So there's a lot of different versions of functional medicine out there. Some are doing a lot of labs, a lot of upfront work. Functional medicine has a lot of moving parts, hand-holding with the patient, sitting down with the patient, educating the patient, keeping track of the results. So what I did with functional medicine, I looked at it. I did functional medicine for years in my practice and I loved the results, but the few things that I didn't like was all the heavy lifting you had to do with the protocols. All the time-consuming things, going over labs, ordering labs, waiting for labs. So what I did is I hired a team and I sat down with them and I said, how can we create a functional medicine program that eliminates all of this, okay? Eliminates all of the noise from the protocol and the process. Because when we look at it, functional medicine is phenomenal at treating patients, but it sometimes bogs your business down, it bogs your staff down, and the process sometimes is just lackluster because of just all the things you're waiting on, all the moving parts. So I sat down with the team that we hired. I wanted to hire a team that was a lot smarter than me. I did a phenomenal job with functional medicine in my office, but I wanted people to talk over my head. So I hired a good team. We sat down and said, okay, how can we eliminate labs in the beginning? Okay, so we came up with a survey process. By filling out the survey, it's a point system and it gives the doctor of who's a good candidate for what we call our program, our Trust Your Gut program, TYG for short, okay? So TYG means trust your gut. So when we went over this, all the doctors that we were working with said, Dr. Gum, a lot of the patients, when you look at them, they get the same thing. We do a ton of labs, but when we look at the basis of the clinical model that they get, they get exactly the same thing. 92% of the people that are getting results get exactly the same thing. So I said, great. So let's build a protocol around that. Okay, so we started there. So we looked at it and we use a burning house as an example. So the first phase is we're putting the flames out, inflammation, and sealing the gut, sealing it up. Okay, so putting the inflammation out, sealing the gut. A lot of people miss this, okay? Because if we don't do this, and then in the second phase, we detoxify the blood. We pull all the things out of the blood. If we don't seal the gut and we try to detox, guess what's gonna happen? That person's gonna have a lot of bad reactions because it's literally going straight into the bloodstream and they're getting a lot of reactions from the detoxification. That's why a lot of people get sick during detoxification. So the third phase, okay, once we've cleared the debris out of the fire, okay, once we clear the debris out, so we seal it up, we detoxify the blood. The third phase is we rebuild. It's the rebuilding phase, okay? So once the firemen get the debris out, the carpenters come in, they look at the house and say, okay, how are we gonna rebuild this back up? So the third phase, we're rebuilding the gut villi, the gut health back up to a normal state, okay? And that's the complete program, 75 to 90 day program, 92%, the same 92% that got all those labs are getting the same exact results with our protocol without the labs, okay? So don't take this wrong. If you're a full functional medicine doc and you love labs, that is great. If you got all the certifications, that's awesome too. You can still do labs with this program. We have a lot of functional medicine doctors come into our program that just want to simplify things. And then if they feel like they can build around it, they will. But usually what happens is they call me and say, Dr. Gum, my patients are getting phenomenal results. I don't know if I even need to do all these labs because you're right. 92% of the people are going to get the result that they get regardless if they get all the testing or not. So what we did is we have a fully functional medicine program, 90 days, and you use a survey to identify that person, okay? So let's talk about the systems in functional medicine. The systems in functional medicine have been around a long time, a little antiquated, a lot of moving parts, a lot of time involved, a lot of energy and time is wasted in this process. So we looked at the systems and say, okay, let's look at all the minutia in this process and automate it so we can save time, energy, and be more efficient with our onboarding process for new patients. So what we looked at is what can we automate into the process? So we looked at the seminar. So most functional medicine docs do live seminars, a dinner seminar, and it requires them, it requires their time, it requires their energy. And sometimes it's just hard to bring your A game every single time. And then if they can't come to that seminar, and then we're doing long consultations where we're making sure that we're educating that patient getting them up to speed on their condition, why they're there, what we do. And it requires a lot of time again in that consultation room, spending a lot of talk time when we don't need to be. And sometimes doctors aren't even doing the pre-education, which is even worse because they don't have the time or energy to do it. So now when we made a video of the pre-education where you can use it in a live seminar format. We teach you how to make technology part of your process, how to do introduction to the seminar, how to close it out. And you can use this tool in a few different scenarios. So if you like live seminars, the positive to this is you're only spending about 10 or 15 minutes of your time. And then now you can use that same pre-education in a one-on-one scenario where they can watch it in a consultation room by themselves, one-on-one, or in the waiting area on an iPad, because all of our stuff's web-based. Or you can do a small group. Maybe you're scheduling 2 or 3 at a time in your office, watching it in your office. Another thing you can do is you can have a reoccurring, what we call a theater room or a pre-education room, where it's reoccurring. You can schedule seminars, one-on-ones throughout the entire day while you're operating during your clinic. So if you need to pop in and do an introduction real quick to a seminar of 15 people, you do the introduction, you go back to work, and then you come in and close it out, or have your staff do the entire process, which is really cool. We have over 250 docs across the country. A lot of docs are doing this. They're saving a ton of time. And it's phenomenal watching it work and watching it operate. And then we have the automated ROF. So if we need a short 10 to 12 minute video, an overview of the program, tells them what it is, the phases that we just went over a little bit ago, what we're trying to accomplish. So when you walk in there, you're just really going into what's important. You're being the doctor, you're going over recommendations. You don't have to go into what we do again. It's literally plug and play. And the patient gets up to speed really nice to where it's teed up for you to close them up and get them started. So another system that needs to be automated is patient education. So we have full curriculum around our program that you can enroll them into our software, and they're going to get messages every single day around the condition, around the protocol that they're getting. So they'll get a recipe of the day, they'll get a wellness tip of the day, they'll have seminars aligned to attend, and they're going to be able to be put into this robust curriculum or patient education that is really phenomenal, keeps them engaged the entire time. Our software also allows the patient to log all their food, their water intake, they can journal, they can upload documents to you, they can even submit virtual questions to your clinic if they have a question about the protocol. So for example, Betty wants to know if pizza's on her food list in phase 1. Comes in, it's all HIPAA compliant. You can have a staff member answering them. No, Betty, pizza's not on your food list. Sorry. That's really cool because now you can manage your patients virtually and you can teach them how to use those systems. So now you can scale your one-on-one calls back, okay, versus coming in the office all the time. And we'll teach you how to do virtual calls as well. We'll teach you how to do a virtual call and manage your patients that way as well. So that being said, with having all these systems and having the patient education online that's automated for you, for the patient, now what you can do is you can add functional medicine to any other type of program and combine niches together and do it very efficiently, because this doesn't take a lot of time for you to manage, because you're letting systems do the work for you as you're doing other work on the other side. So for example, if you have a chiropractic patient coming in and they need we have a survey that they can fill out. Remember, if they're a good candidate, you can add functional medicine to their chiropractic, and now you have double cases, and you can double your collections and add more to your value and have a premium program that you offer. So that's called combining niches through practice automation. So maybe you have a person coming in that has neuropathy or knee pain, but they're a good candidate for our functional medicine program, our TYG. You can combine niches, enroll them into the curriculum, and they can still come into the office and get their chiropractic or their knee or their neuropathy, whatever it may be, decompression. But now you're able to create a premium program that you can offer your patients, and you're addressing neurological, structural, and metabolic all at the same time. And you have all these systems working for you, and you're kind of sitting back and putting your thumb on the systems and manage them. So, recap, we talked about typical functional medicine process. You can still do labs, but you don't need to. We have a survey. We talk about the 3-phase protocol that we have, that we've had our team put together that gets phenomenal results. We've talked about systems, how to automate all these systems in functional medicine into your clinic to take all the workload off your desk, let systems work for you, and now you can combine niches or sell them individually and manage it a lot easier, okay? So all of our metabolic niches really work this way. Our weight loss, our keto, our functional medicine, and obviously our functional medicine program addresses things like autoimmune, thyroid, celiac, all the things that you can think of, eczema, all the skin rashes, anything that you can think of around functional medicine, our protocol helps phenomenally. So I just really wanted to get this video out to you so you can have you kind of paint a picture in your mind of how automation works, how we changed functional medicine. And I'm not saying that the old way of functional medicine needs to change completely. I'm not claiming that I'm reclaiming what functional medicine worked like. What I'm good at is looking at systems and saying, let's simplify things, but still provide extreme value to your patients, get great results, but save time and energy during the same time. So signing off, Dr. Gum, God bless. We'll talk to you soon.